Welcome to the training for healthcare professionals. Let's begin with the module which focuses on intravenous injections. Let's take a look at the key learning objectives. After completing this module, you will be able to explain what is intravenous or IV therapy, select the site for giving an IV injection through the peripheral line, give IV injection through the peripheral line. First, let's see what IV therapy is. IV therapy is the giving of liquid substances directly into a vein. The word intravenous simply means within a vein. It is one of the fastest ways to administer fluids and medications through the body. The vein for the intravenous injection is accessed by way of a needle through the skin. Most times, the needle is connected to a tubing or to a syringe which allows for blood samples or administering fluids. Often, an IV line is placed on the back of the hand or in the arm and is called peripheral intravenous or PIV line. Sites for IV include hand or arm, inner side of the elbow, the back of the palm. In younger children, it is fairly common to administer an IV in the foot. Sometimes, it's necessary to administer medications near the heart or main circulatory system. This is called a central line. Sites for IV include neck, femoral. IV injection is used to administer fluids or saline to prevent dehydration and for parenteral nutrition when the patient cannot eat. It is also used to administer drugs such as antibiotics, steroids, narcotics, chemotherapy medications, osteoporosis medications. IV injection is administered for blood transfusion or to obtain laboratory specimens. Peripheral line insertion is done with a peripheral venous catheter or a small flexible tube with a needle into a peripheral vein. The needle is introduced into the vein and the small tube of the cannula remains in place. The central line is inserted through the skin into a large vein that enters into a larger vein sitting above the heart, so that the tip of the catheter sits close to the heart. Many drugs and fluids are not suitable to be given through smaller veins in the hand and forearm because they could irritate the lining of the veins and could cause small veins to form blood clots and stop working. Central line insertion requires specialized skills and can be administered only by doctors. The items needed for IV insertion are 1. One alcohol wipe, 2. A cannula, 3. Infusion fluid bag with tubing and the drug, 4. Tourniquet, 5. Disposable gloves, 6. Hypoallergenic sterile tape, for example Tegaderm, 7. Sterile gauze 2x2, 8. Hep saline, 9. Three-way connector 10 centimeters. To prepare the patient for IV injection process, you should 1. First verify and confirm the patient's identity. 2. Introduce yourself and state what you will be doing. 3. Explain the procedure. 4. Get the supplies ready. 5. Wash your hands and wear your gloves. 6. Check the medicine for correctness and expiry date. Check rights of medication. 7. Apply a tourniquet to make the veins visible. 8. Palpate the site and locate the vein. Now, for administering IV therapy through the peripheral line, you should 1. Clean the site with alcohol wipe and air dry. 2. Gently insert the cannula at an angle of 15 to 30 degrees in the direction of the blood flow. 3. Gently pull back the plunger. A small amount of blood should enter the cannula, which indicates that it is in the vein. 4. Withdraw the needle and simultaneously push the cannula inside. Connect the three-way connector. 5. Flush the Heb saline into the cannula and close the three-way connector correctly. 6. Secure the cannula with sterile tape and put a label on the plaster with the date, time of insertion, and the sign. You should record all the information concerning the patient and medication, including indication for drug administration, site, dosage, and route delivered, the patient's response to the medication, both positive and negative, the next medicine due. There are some risks involved with the IV therapy. If an IV is not properly inserted or the vein is fragile, the vein may rupture and leak blood into the surrounding area. There is a chance of infiltration and inflammation. Pain and tissue damage could occur. The injected site is likely to get infected. It is advised that an IV be left for no longer than a maximum of 72 hours. Now let us see a demonstration on how to administer IV injection.
Hello, Alice Winter.
That's right.
Hello.
Yes.
Hi, my name's Claude. I've been asked for one of the nurses to come and talk to you about the need to have a cannula in so that we can give you some IV antibiotics. Has anyone come to speak to you about it?
Yes, they have. Yes.
So you understand why you need a cannula?
That's right.
And are you happy to have a cannula?
That's fine, yes.
That's fine, okay. Can I just check your wristband?
Okay.
So you're Alice Winter, 10th of December 1980, hospital number 123456, and that is you?
It is.
Okay. Do you have a preference of which arm I use at all?
No, not at all.
And there's no reason why I can't use one or the other arms?
No, there's nothing that I know of.
Okay. What I'll do, I'll go prepare my equipment and then I'll come back and we'll pop a cannula in so that you can receive your IV antibiotics.
Okay, thank you.
Okay? See you shortly.
Okay.
Hello, Alice again.
Hello.
Hi. Can I just check that you are Alice again?
Yes.
Alice Winter, 10th December 1980, 123456, and you are Alice Winter.
I am, yes.
Okay. I've got my equipment, so I'm ready to be able to put the cannula in. Are you still happy for me to go ahead with this procedure?
Yes, that's fine.
And you still don't have a preference of which arm I use?
No.
Okay.
not at all.
What I'm going to do now is just look and select a suitable vein and just prepare myself to be able to cannulate your arm.
Okay.
Okay.
Yes.
Okay, just position your arm.
Okay.
I'm just going to put a tourniquet on, just to have a look and see what veins. Does that feel okay, not too tight?
Yeah, that's fine.
Okay, let's have a look. Just do that for me with your hand. Lovely, just relax your hand. I can see a nice one there. Feeling the depth. Just looking and feeling the vein. Okay, just relax your hand. That's lovely for me. What I'm going to do is just clean the area using a Sterec. Feel cold. Just allow that to air dry. Okay, do you want to look away or are you okay? Yeah. I'm just going to anchor your vein. Okay?
Mm-hmm.
Sharp scratch. Flashback. Second flashback. And in. Are you okay?
I'm fine, thank you.
just putting on a fixative. There's one. There's two. You can relax your hand a little bit now if you wish. Okay. Just feel a little cold. All done. Just relax your arm down. Keep it nice and still. Lovely.
Okay, thank
Okay,
you.
thank you very much.
Always remember to complete your documentation after the procedure is done. Here are the points to remember. Check the sterile tape dressing every 24 hours to keep track of infection. Gently palpate and inspect the insertion site for tenderness. In the event of tenderness, redness, pain and fever, immediately inform the doctor and remove the cannula. Change the site of insertion. Routinely flush indwelling peripheral cannulae with sodium chloride, 0.9%.